Doctor, as we've just heard, one woman who contracted the virus, she was in her 14th day of quarantine at Howard Springs. Now, that's the final day of the isolation period. Is it concerning that there is a delay in returning a positive test?
Look, it's very hard to work out exactly what the circumstances of this are. I think one of the things that became obvious in South Australia is obviously how infectious this condition is, but also the fact that the risk of having people who are actually positive in there passing it on to, say, staff, for example, and then passing it back to other residents, or direct transmission between people who are living there is possible. So, one of the things that may have to be considered is sort of the South Australian idea of anybody who actually is picked up positive early on being essentially removed so that the risk is less for other people. But look, there does need to be a little bit of work and backtracking to work out exactly what's happened, because it is a little bit of a mystery with that one isolated individual.
Does there need to be a rethink then of testing times within Howard Springs in the event that there might be local cases developing within that facility?
Yeah, we probably do need to consider that to try and make sure we catch it and get the sequencing right. But certainly making sure that they've had one just before they leave is really important, I think. And I think that's one of the main things that they're doing, which is we've got to be critical in ensuring that as they leave, they're not positive.
Let's take a look at some of the cases overseas right now. The UK has identified a new variant of COVID-19, which could be fueling the infections that they are seeing in parts of southeast England. This is what the World Health Organization had to say about it this morning.
This kind of evolution or mutations like this are actually quite common. The question, as we've had most recently with the mink variants in Denmark and the previous variations in the virus, does this make the virus more serious? Does it allow the virus to transmit more easily? Does it in any way interfere with diagnostics? Would it in any way interfere with vaccine effectiveness? These are questions. None of these questions have been addressed yet.
As he just said, we still don't know a lot about this new strain, but is it likely to be more dangerous?
It's hard to know at this stage. I think there's some concern that it's somewhat more infectious. This is the nature of viruses. Essentially what they are is they're genetic sequences or barcodes, but unfortunately as they get passed between people, little sort of errors occur in the barcode. And ones that actually seem to make it easier, for example, for it to move around and transmit may actually become more prominent over time, which may be what's happening essentially in the UK. But we've seen other examples, as you've indicated, about the possible one that passed from the minks in Europe. Look, the gentleman there actually put it out exactly right. The questions are, is it going to become more infectious? Is it going to become more dangerous? Is it going to evade a test? Is it going to affect a vaccine? I think the other possibility, and must be kept in mind, and from people that are far more expert in this than me, is a possibility that it does become actually a bit more benign over time. And in fact, that is the natural course of coronaviruses over time, that they do become less dangerous and maybe they become more infectious over time. So look, we'll have to see, but at this stage my understanding is they don't feel that there's going to be any material change to the key things for us. Will it affect the test and will it affect the vaccine? So at the moment, no major change, but something people need to be aware of.
We've seen today the US has begun its vaccine rollout. The last week the UK did the same. Obviously, in the US, they're experiencing rapid cases of coronavirus. How effective is this going to be in actually combating the spread?
Look, I think the main thing with the vaccines that they've shown evidence of is direct protection of the individual. So that means you get it, you're unlikely to get sick. So Moderna's and the Pfizer's have shown something in the order of 95% chance that you won't get sick. And the AstraZeneca's are in those sort of zone as well. What they don't show, and it hasn't not so clear, but you would think that would be the case, is that they won't stop you catching it and that will stop you passing it on to other people. But that's a secondary question, and that's something we're going to get more information over time. So that is actually what is the separation between whether the virus actually protects an individual or stops spread, prevents spread, is the key thing to actually determining who gets the vaccine first, which is really going to be the people in aged care facilities and frontline health workers and emergency workers in the first instance, because you're going to get biggest bang for buck there, and then slowly build up. And hopefully we'll get more evidence about this building up of reduction of spread and this thing called herd immunity, which is what we've all been waiting for at some stage, so that the thing can't move around the community.
We know about that priority group, as you mentioned, but UNESCO is now calling on governments to give teachers priority access. Should educators be considered in that group?
I have heard that, and I think, look, I think there are a lot of groups that are going to come out and say that they need to come out. I think certainly in some other countries that is a priority, and the balance is this. What I would be saying, remember I told you about the fact that it doesn't, we're not clear that it does stop transmission, but it does stop people getting sick. Now, if you really think about it, we're of the belief that really the students and the younger people are the ones that are least likely to get sick. And there's not a huge level of evidence that generally they're the reason why COVID spreads through the community. So really protecting them is possibly in some way logically the least, but protecting vulnerable teachers is going to be very important. However, having said that, the schools are a really key part of our community, and for parents to be absolutely sure that when their kids go to school they're not going to get it may be something that may actually tip the sort of thinking towards getting the teachers vaccinated early on. So there's a bit of balance and a bit of thinking at the moment, and certainly at the government level there's lots of thought about this.
Let's look at the situation in Sweden. We know in that country early on in the pandemic it appeared that controversial decision not to go into lockdown worked, but now the country is struggling under what's been quite an aggressive second wave. Why did a herd immunity strategy fail?
Because they haven't got anywhere near herd immunity, potentially also potential reinfection, but also I think that they were clearly trying a very unorthodox strategy, and it was trying to, in that situation, trying to balance their community expectations and also the view that they might maintain the economy as well, and that they would still be able to allow the health systems to hold up. Unfortunately, I think they've failed on all those counts. They've essentially failed on the fact that a lot of people have died. The health system is actually just at breaking point. My understanding in Stockholm, I think their ICUs are basically 100% full at the moment, and they're pleading for help. And I think the economy is in a worse position than many other countries, including definitely compared to a country like Australia. So I think the idea about letting it rip and taking a very relaxed approach, trying to balance economy, has actually been proven completely wrong. And the Australian strategies and strategies like New Zealand have been proven right so far.
And just finally, speaking of different strategies, research is suggesting that perhaps a scratch and sniff test could play a role in curbing the spread of COVID-19. Doctor, do you think that screening for loss of smell actually might work?
Oh, it might not pass the sniff test, but the idea of this test is that it's based on the fact that 80% of people, in fact, lose smell or have effects on their smell, even if they're asymptomatic in terms of that early stage. And so the thought is that applying a test of smell to see whether people have got altered smell, and these are quite simple, can be actually done, say, at the before you board a plane or before you go into an event, could be an added test to try and minimise the risk of people getting through who may actually have COVID, particularly in the asymptomatic stage. So there is actually some thought about this. And so it's an interesting new angle, which we haven't thought about, in amongst all other things like using sniffer dogs and things like that to try and pick out people who've got COVID. A little bit outside the square, but definitely got some potential. Yeah,
a bit outside the square, but it's good to see the research. Dr. Chris Moy, thank you for joining me.
It's a pleasure.